If you have a hospital placement coming up, then this video is for you because I just had another absolutely amazing experience on my hospital placement. And in today's video, I want to share with you my top 10 tips to help you guys get the most of your hospital placement coming up. If you guys are new here, my name is Matt and I'm a second year medical student. And in this channel, I share my experiences as a medical student along with my top tips. Now, I do also want to add that some bits of information I have changed, such as comorbidities and presenting complaints, just in order to protect patient confidentiality, but not enough to take away from the point being made. So with that being said, let's get right into the video. Number one, arrive early. On my hospital placement, one of the people that came, they actually arrived just 2 minutes late and they were not allowed into the placement. There was so much that went on this amazing experience, from different workshops at the start and then into the nitty gritty, which was the seeing patients, being on the wards and talking to the patients. Unbelievable experience and one you should not miss. And it's such a shame that if you do turn up just 1 or 2 minutes late, they are very, very strict and they will not allow you access or entry into the room or the workshop. So make sure you come early, account for the fact that the bus might be late, you might have delays on the way, but do not miss this amazing experience. Don't turn up late, even by 1 minute, because you will not be allowed in. Tip number 2, make sure you check the dress code. They're actually pretty strict with what you wear. Now, of course, you've got to be wearing professional clothing. What is professional will be online, so make sure you do some due diligence beforehand. But specifically, there was someone in our group that was wearing like material shoes. I think it was felt or something. They actually weren't allowed to do the ward round and speak to the patients, which to me seemed pretty strict, but at the end of the day, they do have these rules that they have to uphold, and it is important for you guys to read them before you come to the sessions. Just make sure you're wearing shoes that you can wipe any bodily fluids potentially off. That was the argument that they gave, that if there was some blood or some bodily fluids, you need to be able to wipe them off. Just make sure that you read the guidelines on the dress code beforehand, because there's nothing worse than turning up on time, being able to sit through the workshops, but then being told, by the way, you're not actually allowed to do the ward round and speak to the patients, which is probably the highlight and the reason that you're there for, because you're not wearing adequate clothing. So make sure you brush up on the dress code and you come adequately dressed. Number 3, use the workshops before your ward round and speaking to the patients to clear up anything that you're unsure of. Now, specifically, the tutor actually raised the donning and doffing thing for us and also the steps for hand washing. And she said, do you guys know it? And a lot of people just said yes. But me personally, I wasn't 100% sure and certain, so I actually said no, I would prefer you to go over it now. And lo and behold, when we were asked to show the 7 steps of hand washing and then show the actual step-by-step protocol to follow when donning, which is putting on the PPE equipment, nobody had a single clue. Everybody was doing it in completely the wrong order, and I was so glad that I used that opportunity to speak up and say, no, please could you show us and give us an example of the steps that we need to take in order to correctly wash our hands and in order to don and correctly doff. Make sure if you have any other queries, even if people are quite subdued, to put their hand up. Use this as an opportunity to ask the tutor. I know sometimes in groups people can feel like, should I put my hand up? Should I not? But I can assure you it is so much better to get things wrong in that kind of safe space with the tutor rather than being on the ward round with patients in front of you and not know what you're doing. That's more embarrassing. And there you go. That's tip number 3. Tip number 4, be aware that there are far more barriers to communication when you are on the wards. This was so notable for me because I'm actually hard of hearing. I'm deaf in one ear. So for me, it is already really difficult to hear patients. And when I'm doing these consultations, I do struggle, especially wearing PPE while people are wearing masks. Now, the other thing to be aware of is when you're on the wards, you actually have to maintain some level of privacy, and of course, by pulling the curtain to, that's not necessarily going to block out any noise from the conversation that you're having from other people around you, but also there's going to be interfering noise of, patients maybe shouting, there might be radios on, there may be other conversations, the sound of a busy ward, and it is way more difficult than you can imagine to have a conversation. So be aware of that, especially when you're trying to have a private conversation talking about confidential stuff. Be aware that you will need to listen really, really intently, and also to be able to communicate effectively with the person that you're speaking to. Wearing a mask might be challenging and might be difficult, so be more patient and more tolerant to the person that you're speaking to, but just be aware of the volume so that other people aren't listening, and also be cautious that you are able to gather the information that you need to gather. And that is tip number 4. Tip number 5. I have noticed that consultations with an actual patient really do differ to the ones that you will have in the practice environments with the simulated patients. Of course, the simulated patients are actors and they are doing the best of their ability in order to accurately emulate what is happening in a clinical environment. But for me, when I was speaking to stroke patients, it was so different. And a lot of the clinical skills that we learn, specifically right now in our course, we're on the Socrates framework, which is, investigating pain and the steps to go through. And obviously that's not necessarily relevant when speaking to a stroke victim because they've got a neurological condition and it's not necessarily pain that you need to be following. Just be aware when you're running these consultations, just try your best to run the consultation best you can, but be aware it's not going to be exactly the same as the experience that you have had through your training. Do your best when speaking to, patients with neurological conditions like a stroke to try and direct the narrative back onto the actual outcome that you're trying to get from that consultation. They might drift away with their conversation and start speaking to something a little less relevant, but just be aware it is really important for you to try and bring that narrative back onto what you were talking about originally. And that is tip number 5. Tip number 6, really use this as an opportunity to break down that barrier of first time speaking to a patient. I'm not sure where you are in your med school journey, but for me, this was my first actual opportunity speaking to a real patient on my own in a hospital on a ward as a med student. That was a pretty daunting task, and we were actually in odd numbers. There was 7 of us, and everybody paired up in pairs, and I volunteered to do it on my own. And wow, it was nerve-wracking at the start, but as soon as I went into, med student mode, I got on the ward, I just took advantage of that situation. And I think this is an absolutely incredible opportunity to just break down that barrier. Remember, this might be your first ever time communicating with a patient, so don't put too much pressure on yourself. I would probably suggest just use this as an opportunity to have a conversation. Be personal with it, practice your communication skills. Don't put too much pressure on yourself to follow a specific framework. I need to, follow my family history, surgical, medical history. Just treat that person like a human being. Have a conversation. Enjoy the experience. And again, just use this as an opportunity to increase your confidence when dealing with a patient. In time, the confidence will build, and this will give you a much better foundation for practicing and implementing the skills that you're learning from the consultation room and the clinical skills workshops. That is tip number 6. Number 7, realizing how important a systems review is. During these consultations and speaking to stroke victims, seriously highlighted to me how invaluable a systems review is at the end of the consultation. Simply because, when you're having this kind of discussion with a stroke victim and they're struggling to maybe communicate somewhat, and for me, there was a really, really important moment during the systems review that I was discussing different areas such as mental health specifically, that the patient actually told me that they had feelings of self-harm. And for me, that really highlighted that some parts of the history taking that I had with that person, I actually missed off, and it was by doing these systems review actually at the end, I was able to fill in some of the gaps. And from that, we were actually able to have, a good conversation about that person's mental health, which uncovered more information, such as the support system that that person had, and the family members, the loved ones that was actually helping this person. And actually from that, it resulted in them actually wanting to discuss this with one of the clinical specialists on the ward. Now, a lot of these mental health issues actually came from the stroke because the impact to life that a stroke can have. So by having these conversations and doing that systems review, it not only bettered the consultation that I had and for the patient's sake, but also it opened my mind into the actual real impact of diseases and debilitating conditions. So really, really amazing. And it just re-emphasizes the importance of these consultation skills lessons that we do have in the training that we have at med school. Number 8, make sure you do some pre-preparation. And the reason that I say this is because it is a daunting experience speaking to a patient for the first time. It's a completely different one after having, weeks of experience in the consultation room with simulated patients, to then going in a actual ward on your own as a med student and then having to run that consultation. My best advice would really be just refresh up on your consultation skills. Make sure your introduction is absolutely perfect. Don't feel like you're reciting off a piece of paper. Really know what you're saying as you're saying it and why you're saying it. And then also really get up to speed with your history taking. Know the steps. Just make sure before this hospital placement, you're really brushed up on that. The patient or the consultation does digress onto a topic that is probably a little bit off topic. You know exactly what information you've not yet gathered, and you can really easily just take it back on track. Honestly, one thing I realized is the consultation never goes to plan in order the way that it was said, because as you go along and as you discuss things, you might uncover something that's really interesting or really important. And personally, in my consultations, I did actually find myself wondering, wait, hold on, where am I in this framework? And I really do believe that by doing more pre-prep, in knowing everything off by heart and that framework and the steps that I needed to follow, it would have been a lot easier for me to stay on top of and track exactly where I was. Number 9, be open to discuss other diseases and other conditions that the patient wants to talk about. So specifically, I was speaking to someone on the stroke world who had been living with COPD for a number of years before their stroke diagnosis. And this person was actually more bothered about their COPD diagnosis. So the majority of our consultation actually revolved around that diagnosis as opposed to what they were actually in the hospital for. And I uncovered so much really interesting information on this, and it was clearly a topic that the patient wanted to discuss. So I just allowed that patient to kind of take control in regards to what they wanted to deliver, because they were giving me so much interesting information, and for me it was just a fascinating one hearing about this. But especially on this hospital placement where it is an opportunity for you to really just hone in on your communication skills. If a patient really wants to talk about something and they're going to divulge, and it is somewhat helpful and beneficial to your learning, allow that to be the case, because again, these are your preclinical years if you're in year 1 or year 2. So just use this as an opportunity to better your communication and your acumen and proficiency in a clinical environment. And tip number 10, the final tip, do your PPD write-up as soon as you get home. This is because all of the information that you've just taken in on that amazing bit of clinical experience is going to be so fresh on your head, and it really gives you an opportunity to just put everything that you've seen into perspective. That is the purpose of reflective writing. I find it a hugely beneficial thing because, especially on a clinical placement, you've got so much different bits of information that you've just been accustomed to. You want to be able to just put it down in a digestible form, and that is why PPD is a really great thing. Personally, I use dictation on my phone. I just pull up the notes tab and I speak to it as if it's a person. So I'm able to just get down all the bits of information in the most literate way that I possibly can. And for me, it actually breaks down that barrier of it feeling like a work task. I speak to my phone, I use dictation, and then I copy and paste that onto my PPD write-up. So really helpful task. Do it as soon as you get home. And there you guys have it. Those are my top tips to make sure you get the best from your clinical placement, whether that be on a hospital. You can use these tips as well for the GP placements or whatever else. These are tips that I personally found extremely helpful, and I think that you guys will find very helpful as well. If you guys have enjoyed this video, make sure you hit that like button and also subscribe from me for weekly uploads, tips about med school, and also to hear more about my journey. Also, check out these other videos that have popped up on the screen, and yeah, that is pretty much all from me. And follow me on Instagram, links in the description below. But as always, I'll see you in the next one.